Hi, today we're going to talk about the axilla skeleton. First we're going to talk about the cranial bones. Here we have the frontal bone. And you can see here we have the pair of parietal bones. You have your occipital bone and the external occipital protuberance. With the external occipital protuberance, it is where the muscles that keep the head upright and allows it as well to tilt backwards are attached. Next we have our temporal bone. And the temporal mandibular joint is here. Mastoid process is here. Styloid process is inside in here. The external acoustic meatus is here. And the squamous part is the flat portion of the temporal bone. Now for an internal view, we are looking at the petrous part, which is here, which houses the middle and internal ear cavities, and the internal acoustic meatus, which allows the cranial nerves 7 and 8 to pass. Then we have the sphenoid, which is here. With the sphenoid, you have your superior orbital fissure, which is here, and that allows cranial nerves 3, 4, and 6 to pass. You have your lesser wing and your greater wing. You have your optic nerve here, and the optic canal allows the optic nerve number 2 to pass. Then you have your sella turcica, which encloses the pituitary gland. Lastly, for the internal views, we have the ethmoid bone, and it is here. The tip part is the crista galli, which is where the dura mater attaches and helps secure the brain to the cranial cavity. On the sides, we have the cribriform plate, and with that, they allow filaments of the olfactory nerves to pass from smell receptors of the nasal cavity to the brain. Now we're going to look at some sutures. Here we have the coronal suture. Here we have the sagittal suture. And here drawn in is approximately the squamous suture. And here is the lambdoid suture. And looking at the facial bones, we have the maxilla, and the alveolar process is here and here. The nasal bone is here. We have the zygomatic arch here. We have the ethmoid bone, which is internal here, and the vomer directly underneath that, internally as well. We can't see it from here. We have the inferior nasal concha, which is inside here. And with the zygomatic bone, the maxilla and the zygomatic bone make up the zygomatic arch. And with the vomer and the ethmoid bone make the nasal septum. Now onto the mandible. Here is the mandible. We have the body. We have the angle and the ramus. We have the mandibular condyle and the mandibular notch and the coronoid process. Next, we're going to look at the vertebral column. So here you can see the vertebral column. We have 2 primaries and 2 secondary columns. The primary is the thoracic and the sacral, and the secondary is the cervical and the lumbar. with the cervical vertebrae, there are 7. And here is the atlas, which is the very first vertebrae. And with this, this bone has no body or no spinous process. It consists of an anterior and posterior arches and a lateral mass on each side. They carry the skull and allows a person to say yes. Yes. What is unique about the transverse process of all cervical vertebrae, with the exception, including the atlas, is that they have an open transverse foramen right here. And with that, it allows the vertebral arteries to service the brain. Next, we have the thoracic vertebrae here. And with that, there are 12 thoracic vertebrae. And as you can see, here's the spinous process, the transverse process here, the intervertebral foramen is in here, and the body, which makes up the bulk of the vertebrae. Now, the position of these intervertebral discs is that the spinous process points sharply downward, and with that, it restricts flexion and extension. You have your lumbar vertebrae, which there are 5. You have your fused sacrum. There's 5 fused vertebrae here, and at the very bottom is the coccyx. And depending, it could be 4 or 5 fused vertebrae along the coccyx. Now we're going to look at the sternum. Here is the sternum. This is the manubrium. This is the body. And this is the xiphoid process. And this is the jugular notch. Next we have the ribs. We have true ribs here, which attach directly to the sternum, and false ribs that do not attach directly to the sternum. Then there are the floating ribs. This here is the head of the rib. Here is the neck, and here is the tubercle of the rib. With true ribs, the true ribs directly correlate with the thoracic vertebrae. Thank you.